Welcome back to it, guys. The Wednesday edition of the Now Morning Show continues, and we're talking wellness. This morning, we are joined by the Director of the Surveillance, Disease and Prevention Control Division, Dr. Horace Cox, who is going to give us a little bit of insight onto the Caribbean Public Health Agency's Caribbean Wellness Day, happening this Saturday, the 13th of September. Welcome to the Now, Dr. Cox.
Thank you very much. It's a pleasure to be here, and a pleasant morning to both you and the viewers.
I appreciate your enthusiasm, because when you're talking about wellness, as we were saying, it is a big task to get people to take care of themselves over time, especially with changing behaviors. So getting into the conversation, this one was established for some time now, but each year we focus a little bit differently. This year, what is the focus for Caribbean Wellness Day?
Thank you so much. That's a very important question. And to be honest with you, this year we're focusing on the individual. So we're happy that you have so many viewers tuned in, because we want them to appreciate the role that they can play in ensuring their own wellness. And so as a result, the theme for this year is about engagement, empowerment, and elevation. We're thinking about working together to ensure that we improve the health and well-being of all. And so just making an appeal to all those who are tuned in, as we share these messages, we want you to appreciate the role that you play and how you can help advance your own health and well-being.
Now, we know as an individual how that immediately impacts us, but the bigger picture also translates into the nation and the region itself altogether, because we are talking communicable diseases and how that impacts job loss and the manpower that we need. I definitely get the big picture, but there are sub-themes as well. So expand a little bit on that and how we will play into that as well.
Yeah, it's an important point. The reality is that in the Caribbean, often we tend to relate to things that are infectious diseases. If I were to ask about COVID-19, everybody would be able to relate it,
right.
Dengue, etc. But the reality is that when we look at the actual burden, 75% of deaths in the Caribbean region is caused by chronic non-communicable diseases. That's 3 in every 4 persons that are dying. They die because of this particular issue. So when we look at it, you spoke about burden and how it affects the economy, etc. Not only does it affect productivity, but it also materializes in terms of a burden on the health system, and the need to invest more to take care of persons. And among those, we find also that cancer, diabetes, cardiovascular diseases, those are the most common. And so we want persons to be sensitized to be able to appreciate how they can help to prevent these things by addressing modifiable risk factors.
Those are some startling statistics, quite honestly. So let's jump straight into how CARPHA is going to help us, the individuals, to actually make positive impact on those sort of numbers.
Correct. And we do realize that it extends beyond the individual, that there's several components here, because as we tend to refer to a lot, we have determinants of health, the social and commercial determinants. And so there are many things happening within society, but we wanted to place the focus on, in conversation with other actors, the individual, because we believe that if we can engage the individual, empower the individual, then that's a good way to start in terms of effecting some level of change. And so the focus this year is on the Caribbean plate with movement. And the reality is that often when we think about what's happening in the year also, how many times are we so busy that we just subscribe to purchasing fast foods? And indeed quite tasty, exactly, we can relate it. But the fact is that we want to encourage persons to, as far as practical, have more of this individual drive to ensure that we're engaging in local cuisine, homemade cuisine, and that the reality, when we look at the plate composition, that we have about half of the plate that would be just vegetables, a quarter the staple and preferably ground provisions, and the other quarter, of course, protein. That would be very important for our development. So it's not just about the plate, but as we say, the Caribbean plate, because this is a Caribbean tailored intervention, and we want it to be with movement, because it wouldn't be surprising to many that one of the main causes of these chronic non-communicable diseases is, in fact, inactivity. And many persons, we say, oh my, I've been so busy, I've not been able to exercise of late, or I've been so busy doing another thing that I've not been able to stick to my routine. But the reality is that we need to make this concerted effort to ensure that we can deliver in that regard. And that's the appeal, the Caribbean plate with movement.
It sounds doable. I mean, the plate sounds delicious, quite frankly, and the movement doesn't have to be anything strenuous. It sounds very, very doable, but I know that you are going to drill down into actions that we could take even more so come the 13th. So tell me what that's going to look like in terms of the actual observance.
So in terms of the observance, the Caribbean Public Health Agency, in collaboration with many other stakeholders, including the Ministry of Health of Trinidad and Tobago,
Of course.
would be pushing for there to be several observations. One is that we'll be having several engagements on media to ensure that we raise awareness. It's important to note that all of this stems from the mandate that was given from the 2007 Port of Spain Declaration. And there again, we see that Trinidad and Tobago was in the lead. This happened in Trinidad and Tobago, where you had heads of government coming together and making a declaration that this is an issue in the Caribbean, it's affecting our people, and in order to improve their health and well-being, we need to advance this. And so apart from the media engagements, with the interest of sensitizing persons, we're also going to be having different messages that are available on social media and using different platforms. For example, the Caribbean Public Health Agency has its website, CARPHA.org,
Of course.
and you can access there to ensure that you can get accurate information that reflects some of the realities that you should be guided by in making your day-to-day decisions. And of course, you'll find that in different ways, you have persons that will be engaged in physical activity. You'll have walks, you'll have runs. So it all depends. But we have a calendar events that would range from what's being done within the agency to extends within the community and even nationally in conversation with others. And so we would encourage you to access our social media platform as well as the website to see how you can be better informed regarding what is afoot and what we have in store for you.
Lots of ways to get involved across the country.
Indeed.
And even if you're traveling within the region, I imagine there will be things that coincide, because this is definitely going across the waters. Now, we've covered a little bit of the individual actions that immediately stick with me. That place is definitely one I could do. Movement, not so hard. And then, of course, getting the education from the right source. Granted, though, that we actually have data to show how this is impacting us or how slowly we're adopting these things, can you describe to me what Trinidad's actual position is right now? As much as we are the leader in terms of where it happened, are we actually showing that change?
It's a brilliant question, and I'd just like to take the opportunity on behalf of the Caribbean Public Health Agency to congratulate Trinidad. I think Trinidad is one of the leaders. I would have said it's the Port of Spain Declaration from 2007. And living in Trinidad, I can certainly relate that Trinidadians or Trinbagonians are certainly active. And this certainly helps, because this is one of the things that we're stressing. But setting that aside, there are certain policies that Trinidad and Tobago would have advanced through the Ministry of Health over the years to ensure that they align with some of the deliverables that are to be achieved from the 2007 Port of Spain Declaration. One such is that they've advanced the enhancement and strengthening of policies and frameworks. So for example, there would have been strategic plans that are tied to the prevention and control of non-communicable diseases. In addition, there's a signature movement that would have been commissioned, which is called Trinidad and Tobago Moves, TT Moves. And this aligns with Caribbean Moves also. It was something that many persons would have subscribed to. And of course, I know that there are many policy discussions afoot within the Ministry of Health that are targeting how to ensure that they can manage this problem. And of course, in managing the problem, as we so emphasize, engage persons and empower them, that they can see that they're at the center of it and that you, the viewers, can effect the change that we so recommend.
So we're looking good. We'll hopefully be doing better. And ultimately, in terms of leaving a message to make sure that we do that, Dr. Cox, what would you say to the people of the nation to make sure that we take the most positive possible approach to Caribbean Wellness Day?
It's a very important question, and I start by responding by saying that we want you to understand that the change begins with you, and that you have a right and an obligation, a responsibility to take care of all of those within your household. And we love our Caribbean flavors, so what better than a Caribbean plate? And as I said before, we love our movement as well in many forms. We hear a bit of music and we start dancing, right? So it's about being innovative. Something as simple as that would help persons. And so bringing it back, our focus this year for Caribbean Wellness Day is the Caribbean plate with movement. And when I think of all these things, I think this is the essence of our Caribbean people.
It is.
And so I see that we can really help to advance this. But remember that we continue to struggle in terms of addressing chronic non-communicable diseases. And therefore, we would want to ensure that persons appreciate that this really is a problem. You can relate to the number of persons that perhaps within your household, community, or further field that would have died from cardiovascular diseases, that perhaps would have diabetes. So these are real issues, and we need to appreciate them and treat them aggressively. But to reiterate, it begins with each of us as an individual. And so we're engaging you to empower you so that you can elevate this as and understand it to be a real problem so that we can create the change that we so desire to see.
Thank you so much, Dr. Cox, for really making it sound very doable, reminding us of the resources that we have available to make it happen, and of course, making sure that we can all have a better health. We are observing Caribbean Health and Wellness Day on the 13th, but it's definitely something we do each and every day. So thank you for the reminder.
I appreciate that.
You guys can do your part, and I'm going to fix my plate. But for now, we take a break and come back with more here on the Now Morning Show.